COVID numbers in South Africa keep rising while hospital admissions remain low. As South African hospitals are bracing for a surge in admissions as the new Omicron variant drives a sharp rise in coronavirus infections, it remains to be seen if we will see an avalanche of new patient admissions. What should we make of this? Joining us now is Professor Shabir Madhi, the Dean of the Faculty of Health Sciences and Professor of Vaccinology at the University of the Witwatersrand. Professor, a very good evening to you. Thank you so much for joining us and a warm welcome to The Full View.
Thank you for having me.
Well, initial data, Professor, suggests that the Omicron variant may cause milder illness, especially amongst those who've been vaccinated or previously infected with the virus. So could this be the reason why we see a rapid surge in infections while hospitalizations, on the other hand, remain low this time around?
Very much so. Although the Omicron variant is antibody evasive, and that antibody is induced by past infection as well as vaccines, and one of the reasons why we're experiencing so many reinfections and breakthrough infections, then there's another important arm of the immune system known as T-cell immunity. And those T-cells are especially important in destroying infected cells, so preventing the infection progressing to severe disease. Now, those T-cell responses are relatively less affected when you have this type of mutations that are present in Omicron, as was the case for the Beta variant. So what's happening in Gauteng, as an example, we've just completed a serious survey which we evaluated what percentage of the population have got some sort of immunity, either from vaccination or past infection. And as it transpires, almost 3/4 of people in Gauteng, 73%, have actually got underlying immunity. And it's probably this underlying T-cell immunity that is preventing the progression of the infection to severe disease and resulting in much fewer cases of both hospitalization and death compared with what we experienced during the course of any of the 3 previous waves.
Well, Professor, is it at all possible to tell if all these cases are Omicron, or could some cases be the remnants of the previous Delta variant?
Yeah, in fact, one of the PCR tests that we use in the public service as well as the private service is able to distinguish between Omicron and earlier variants because of one part of the gene sort of missing when it's tested on those assays. And all indications are right now in Gauteng, 95% of all infections that are occurring is a consequence of Omicron. So Omicron has very much outcompeted the Delta variant in Gauteng, and that will probably be very much the case in many of the other provinces very soon.
Well, the effectiveness of COVID-19 vaccines against the variants is another matter in contention. Pfizer, for instance, has conducted a study which showed that the effectiveness of the initial 2-dose vaccination series fell significantly against Omicron. Just how effectual then is the booster shot in terms of restoring protection?
Yeah, so we need to be clear. Pfizer didn't show that the effectiveness of the vaccine is down. What Pfizer showed, as well as South African scientists, they showed that an antibody that's induced by vaccines has got about 40-fold less activity against Omicron compared to the antibody activity against the ancestral virus. But what we're beginning to understand is that that antibody is important to protect against infection. But when it comes to protecting against severe disease, it's not necessarily the antibody that's protecting against severe disease, but rather the T-cell immunity that's being induced, both by infections as well as by vaccines. So the 40-fold reduction in antibody activity against the variant doesn't equate to loss of protection, but especially not for a loss of protection against severe disease. I expect even with the Pfizer vaccine, you would probably continue getting 80 to 90% protection against severe disease due to Omicron, whereas unfortunately the vaccine would work much less better in protecting against infection and mild COVID-19. But we're not interested in protecting against the sniffles. What we are interested in is vaccines as well as past infection need to limit the number of people that end up in hospital and die of COVID-19. And the majority of cases, a vast majority of cases, including many cases diagnosed in hospitals, are actually being diagnosed in individuals that have mild illness. And in hospital environment, as an example, many women that are coming to actually deliver the babies are coincidentally testing positive for the virus when they're being investigated to assist in a triaging in the hospital. So I think we're actually in a very good space in South Africa in that we've got a large percentage of the population that has got immunity against severe disease and death, even though we're reporting large number of cases. I wouldn't be too panicky about the case numbers increasing. Those case numbers will continue increasing for the next 2 to 3 weeks in Gauteng and much greater in other provinces over the next 4 to 6 weeks.
Now, Professor, considering that the age profile is different from the previous waves, I mean, could the younger adults and children being admitted to hospital be an indication that they are more susceptible to the new variant?
Well, everyone is more susceptible to being infected with this virus, irrespective of what age you are, because this variant seems to be much more transmissible than even a Delta variant. So you might see a slight increase in hospitalization, including of children and younger age groups. But we need to be cautious about how this data has been interpreted. So as an example, at Chris Hani Baragwanath Hospital, of all of the children that are testing positive for the virus, only 1/5 of them, 20% of them, are actually being admitted for COVID-19. The other 80%, we're actually identifying this virus completely coincidentally because every child that's admitted to the hospital is tested. The same thing goes in the age group of between 18 and 39 as an example. Many of the cases that are being identified in hospitals are pregnant women that are coming in to deliver a baby, and they're being tested for the virus, and they're coincidentally ending up testing positive. So the hospitalization that is being reported as COVID-19, in fact, is not COVID-19. Some percentage of it is COVID-19. But right now, based on data that's available, it seems a high percentage, probably 50%, if not more, of those cases that are being diagnosed in hospital as being infected with the virus are actually being hospitalized for non-COVID conditions.
All right, Professor, lovely chatting to you. Thank you so much for your analysis on this matter.